This is Average Joe PT, and on last episode we talked about piriformis syndrome, and really is it sciatica or is it just coming from that muscle? So I'm going to leave a link up there. Watch that after you watch this. This episode specifically is going to talk about spinal decompression and all the hype of it. Is it really worth it? What are the precautions for it? Should you be doing that at all in the home? So stay tuned. Spinal decompression and all the hype of it really goes back hundreds and hundreds of years to just traction. Really what that is you're looking at the spine and you're just pulling it apart. The words decompressing, really all that means is that you're opening up the space to allow more area there for if you have a disc herniation or disc bulge. Now there are several reasons why you would not want to do that in your home, as well as there are several reasons why you would want to do that in your home. So we're going to go over some of those right now. So number one, why you would not want to do that in your home is if you're having a lot of nerve pain down your leg, in your back, shooting down into your foot, and you go ahead and you do that spinal decompression, if you're opening up that spine, then what's going to happen is you're going to irritate the facet joint, and you might even push that disc back out into the space and cause more inflammation in that area. I talked about in the last video, I'm going to leave a link up here afterwards, that's all about the histamines, cytokines, all these different chemicals that happens when the disc accidentally pushes into the nerve, and all of a sudden you have this inflammatory process. If you're giving yourself decompression, in this case static decompression, where you're just holding it there. Now I'm going to show you a few videos here. This is me just showing you static decompression of the spine. Now you can do it in standing and kind of hold your arms there, and you've seen this in videos before, hopefully on the internet. You can actually just do it if you're just lying in a hammock. If you're just kind of swinging there in a hammock and just hanging out there, you're getting a flexion or decompression going on at the spine. Or you can just lie over a couple pillows. Really put the pillows at your belly button, and that's just going to open up the spine. Now, when we're talking about one reason why you would not want to do that besides the static inflammation is if you're having any kind of weakness in your foot, feels like your leg's giving out, feels like the leg wants to buckle, you do not want to do any static decompression, because it's really going to put a lot of excessive pressure, pounds of pressure, torque in that spine, and it's going to put a lot of excessive pressure on the ligaments, on the muscles that have already stretched out, and as well as the disc. Now, you can give that static stress for only a very short period of time. We're talking 5 to 10 seconds and then relax. 5 to 10 seconds and relax. Now, when you're in the clinic and we're doing these spinal decompression, which are these various machines, they've over the years have said, name them the decompression 9000 and the decompression TX, and they are all derivative of essentially just spinal traction. And really they load and unload or stretch and decompress and release depending on really several things: how long you are in your healing process, if your symptoms are decreasing, or if your symptoms are increasing. So that's number two. Number one is if you're having any kind of inflammation where you're getting a lot of pain down in that leg, you do not want to do static decompression. Number two, if you're having any weakness in that leg, it's giving way, it's buckling, you don't want to do that one. And three, if you're doing static decompression in the home, you want to make sure that you're not on some sort of tilt table or an inversion table that can really give you a lot of pain once you actually unload back off of that and you reload the disc. You can give you a lot of pain immediately. So be mindful. If you're doing any kind of decompression, you want to load and unload it every 5 to 10 seconds. Disclaimer, you really should be doing this in the clinic. Okay, 3 reasons why you would want to do this at home is if you're not having any radiating pain down into the knee, past the foot and the ankle, if you're just having up in the butt area, and we've already looked at my last video on piriformis and it's really coming from just the disc, you can go ahead and just unload that lying on your stomach with some ice for maybe 5 to 10, 15 minutes at the most, and do that several times a day. That'll help that. Number 2, if you're having no weakness at all in the legs, your leg is fairly strong, you're just having maybe some buzzy tingling sensation, maybe down into the thigh a little bit, but it's not ridiculous shooting nerve pain, then you can go ahead and do that decompression. And then number 3, the big one really, the takeaway is if you're doing the decompression, you always want to do anti-inflammatories, you always want to do rest, and you always want to do ice in between that whole phase. So if you're doing that first 3 days, you definitely want those pieces of that going on. Now, there's all kinds of exercises out on the internet in regards to, decompressing, how to get rid of the pain quickly. Let me tell you, there's no way to get rid of that pain quickly if you're not doing anti-inflammatories, icing, and resting for 3 days. You have to do those first. After those 3 days, you want to continue that. You just don't have to be as rigorous and do some of the exercises. I'm going to leave a link in there of some McKenzie extension back exercises I've shown you in the past. So I'm going to leave a link for that you can watch after this video. If you have any questions, hopefully you'll give me a thumbs up, give me a like of this video so we can get this out to other people to help them out, the things that they should and they should not be doing with some of the stuff that they're seeing out on the internet. But give me a DM down below if you have any questions. But until next time, Scully and I always like to say, look up and keep smiling. See you next time, folks.